Okay, we'll study about the blood supply of the hind limb. Now the abdominal aorta, terminal branch of the abdominal aorta will form 4 branches. It's called as quadrification. Okay, at the level of 5th lumbar vertebrae. So the 4 branches of the abdominal aorta are the 2 external iliac artery. So this one external iliac, another external iliac, and 2 internal iliac artery. 2 internal iliac arteries. Now the external iliac artery will supply mainly the muscles of the hind limb, whereas the internal iliac artery will supply the internal iliac artery will supply mainly the visceral organs of the abdominal cavity and the pubic cavity. So the external, now coming to the branches of the external iliac artery. So the first branch of the external iliac artery is the circumflex iliac artery. So this is a circumflex iliac, and this will form again, will divide into 2 branches. So the first branch is the proximal branch and the distal branch. Proximal branch will supply mainly the sublumbar muscles, whereas the distal branch will supply the abdominal muscles. So this is the first branch, which is the circumflex iliac. So the second branch is called as the deep femoral. Deep femoral will have 2 parts, which is the pudendo-epigastric trunk and the medial circumflex femoral. So medial circumflex femoral will supply all the adductor muscles of the hind limb. Now the pudendo-epigastric trunk again has 2 parts. Now this is the external pudendal artery and the caudal epigastric artery. Okay. Second branch, which is the deep femoral. The femoral artery will continue down into the femoral canal. Now the femoral artery canal will give rise to a branch called as lateral circumflex femoral, which mainly supplies to the quadriceps femoris. All the 4 heads of the quadriceps femoris is supplied by the lateral circumflex femoral artery. Then the next branch of the femoral artery is the saphenous artery. Okay, this is the saphenous artery, and after saphenous artery, it will give rise to caudal femoral artery. So this is the caudal femoral artery. The saphenous artery, caudal femoral artery, and just lateral to the caudal femoral is the descending genicular artery. So after giving rise to the descending genicular artery, the femoral artery will continue as the popliteal artery. Okay, we'll study about the arterial supply of the hind limb. So this is the femoral artery. The femoral artery in the middle of the femoral canal will give the saphenous artery. The saphenous artery will continue down to form to give 2 that is. Now the saphenous artery will give rise to 2 branches, that is medial plantar and lateral plantar. Okay, so this is a medial plantar and lateral plantar, which then, okay, now the saphenous artery, I'm continuing, will give medial plantar and lateral plantar. This will then form proximal deep plantar arch, and it will form distal deep plantar arch, and these are all the arterial supplies mainly to the plantar aspect of the hind limb. Now the femoral artery, after giving rise to the saphenous artery, will continue down, same as the femoral. Then it will give 2 arteries, that is descending genicular artery and caudal femoral artery. After giving these 2 branches, it will continue down as popliteal artery. Now the popliteal artery will continue as only for a short distance, and it will give 2 arteries, which is called as cranial tibial artery and caudal tibial artery. Now this is the cranial tibial artery. The caudal tibial artery will end up to the stifle region only. Now the cranial tibial artery will continue down to form the dorsal pedal artery, and then after dorsal pedal artery it will continue down as the dorsal metatarsal artery 3. Continue. Now the cranial tibial artery, as I told, will continue as dorsal pedal artery here, and in the metatarsal region it will form the dorsal metatarsal artery 3. Then it will give rise to common dorsal distal artery 3, and then interdigital artery it will give a branch, and then forms the proper arteries. So this is on the dorsal aspect of the hind limb. Okay, we'll study about the internal iliac artery. So after the external iliac artery, 2 branches. The medial side, there are other 2 branches called as the internal iliac. So coming to the branches of the internal iliac artery, the first branch of the internal iliac artery is the umbilical artery. So this umbilical artery is only functional in case of fetal life. Now the first branch is the umbilical artery, which is only functional in case of fetal life. So in adult life, it will become fibrosed to form the round ligament of the bladder. So you can see this is the bladder, and it is attaching to the bladder. So this is the round ligament of the bladder. Along with the round ligament, the cranial vesicular artery also runs along this tract. In case of females, there is another extra artery called as the middle uterine artery, which is helpful in finding fremitus in case of females during pregnancy. So this is the first branch. The second branch of the internal iliac artery is the iliolumbar artery. Okay, this second branch is the iliolumbar artery. So this is the iliolumbar artery. It will have two branches called as the sixth lumbar artery and the lateral sacral artery. So this is the second branch, iliolumbar. Third branch of the internal iliac artery is the cranial gluteal artery. So this will pass into the greater ischiatic foramen. So after giving that third branch, the internal iliac artery will continue downwards to give a branch called as the urogenital artery, which is a very thin artery which is cut in this section. The urogenital artery will again form two branches called as the caudal vesicular artery and the caudal uterine artery. The caudal vesicular artery will mainly supply the bladder, and the caudal uterine artery will give blood supply to the body of the uterus and the cervix. Okay, after giving the urogenital artery, the next branch is the caudal gluteal artery, which will pass down the lesser ischiatic foramen. Okay, the caudal gluteal artery, which will run down into the lesser ischiatic foramen, will continue as the internal pudendal artery. So the internal pudendal artery then will give rise to two branches called as the caudal rectal artery for the caudal portion of the rectum, and the dorsal perineal artery for the dorsal aspect of the perineal region. The internal iliac artery, after giving the caudal gluteal artery, will terminate into two branches. So these are the last two branches. Okay, coming to the branches of the internal iliac artery, after giving this branch called as the caudal gluteal artery, the internal iliac artery will continue as the internal pudendal artery. So internal pudendal artery will give last two branches, terminal branches, called as the dorsal artery of the penis and the perineal artery.